Oh, we're going to do a lovely another video here. No craft, just a little bit of ranting is what I'm going to call it, for lack of a better word, or a better idea for it. So, I've worked in healthcare for 15 years as a certified nurse's aide CNA. Before that, I did 2 years of home health. I have been a med aide for 8 years. I did social services as a social services designee for 5.5 years. So, never in my life have I been in any place that treated people so horribly and so badly than the place I started working at, like, literally 7 days ago. I've encountered the worst of the worst on nurses, and I have to say, this specific nurse I am currently working with takes the cake. I mean, dear Lord, what is it? Why do you have to tear people down? Why do you have to be rude to people? I'm working with a group of CNAs, med aides that are very cliquish, who think that it's okay to treat other people like crap. I don't care if they're brand new, fresh off the boat, fresh out of CNA class, brand new med aide, brand new nurse, whatever it may be. This is ridiculous. And all I can wonder is, I've been doing this for 15 years certified, 17 years if you don't factor in the certification, because I was doing home health, independent living home health, which doesn't require anything because they have the right to hire their own people as they see fit. What gives you the right or the audacity to treat other people this poorly? I mean, seriously, the job is hard enough. We do not need to have people like this in healthcare. I mean, this is downright ridiculous. There is no call for this, no need for this, no reason to be this nasty to people at all. No reason for this. This is ridiculous. So here is my point to this message. If you are working in healthcare, there is fundamental things you need to have. Here they are. 1, you need to have respect for other people, regardless if they are above you, same level, or what you consider beneath you. Because guess what? We're all there for the same purpose. Number 2, you need to actually care about your residents or your patients, whatever you would like to call them, and actually have a heart to do this job. Not just, oh, I'm here because I'm getting paid for a paycheck and I get boss people around. That is not your job. Your job, first and foremost, is to take care of your people. Number 3, if the resident/patient doesn't want to comply with the medical orders of the doctor, regardless of if they should or not, because obviously they most likely should, it is not your job to sit there and tell them, you have to do it, the doctor said so. It is your job to educate them to the consequences of not complying. But if they don't want to do it, don't want to comply with that, that is their prerogative. They have rights. They have the same constitutional rights as everyone else. It's not your job to sit there and tell everybody else that works under you or works in the same department, whatever, that you supervise or are outrank education-wise, well, they have to comply. No, they don't. I am telling you, from having worked in social services for 5.5 years, they don't have to comply to doctor's orders. Yes, we would like them to. Yes, it would be better if they did. But they don't have to comply. They can AMA against medical advice. They have that right. Learn that. And stop treating other people so poorly. Stop treating your families of your residents poorly, or patients, whatever you want to call it. Stop treating your residents like they don't have rights because they're in a nursing home. They're in a nursing home because they need assistance, not because they need somebody to tell them how to lead their life. Stop treating your CNAs, your med aides, your social services people as if they don't matter, as if they don't have valid points to what they're doing. Rather than do that, maybe, just maybe, you should hear them out. Hey, this is what's going on with so-and-so that I've observed. Blah, 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 so forth, so on. And figure out a solution. Rather than saying, oh, we're the nurse. We know best. Maybe you don't. Because you're a nurse. You're not out there. You're not on the floor. You're not dealing with everything that's going on day in, day out. Or dealing with knowing, hey, they're not complying to their meds, and so maybe that's causing a problem. Or, hey, they've just had this happen, and maybe that's causing a problem. Or a combination of things. Utilize resources appropriately. CNAs are out there on the floor. They're the front line. They know what's up. Med aides are the second of the front line because they're giving meds. And if those meds aren't taken, they can tell the CNAs, hey, might be a problem. They didn't take their meds. So, no meds on board for these situations, da-da-da-da-da. So, there's your second line. Third line, your nurses, your social services, and all those other people that work in the facility, the building, the healthcare situation, whatever you'd like to call it. That whole system was set up for a reason. The government realized, hey, we need to adhere to their personal choices as well as their nursing needs, their medical needs. That is why it was set up. So stop tearing people down, chewing up and spitting out your newbies, your young, whatever you'd like to phrase it as, and utilize the resources and knowledge and experience of people who have made a career out of being CNAs, a career out of being CNAs and advancing to a med aid, a career where they've actually went into social services. Stop tearing people down. It's ridiculous. It is so badly ridiculous that I personally have gotten to the point. I have my CNA, I have my CMA, I have my social services designee, I have an Associate's of Applied Science in Health Information Technology. I have 14 credentials, starting with my CNA up. 14 credentials. Saying I know what my job is. I know my stuff. I know what I'm doing. I'm a dementia capable care certified trainer. And people are acting like I don't know. Fine, whatever, that's on you, not me. Because you didn't ask me, hey, what's going on, da-da-da-da-da. No, you just automatically assumed and jumped to a conclusion. That's not cool. But this is my point, my whole point. I'm so fed up with seeing this system repeatedly go on in places. And like I said, the worst place I've ever been is in 15 years is the place I'm at now. The worst. It is. I don't even have words for it aside from wow. I am so at a loss for understanding and fed up and just like flabbergasted that I am going to take my operator's training course so I can actually supervise others. Why? So I can actually help others to improve themselves without being rude, without tearing them down, without having to call them out in a public forum, in a hallway, in a dining room. That's not cool. Not cool. That says I'm unprofessional. So for everybody out there who's sitting there in a supervisory position or who has a higher level of education, stop what you're doing. Think about what you're saying. Think about how you're saying it. Think about how you're approaching people. This is ridiculous. There is no need for this. People are not inherently stupid, for the most part. People who are in healthcare, they have some intelligence. They can learn more. But if you keep tearing them down, you're not going to get them there. All you're doing is being rude to benefit yourself, to make yourself feel better. Get over yourself. It's not about you. It's not about you. It's about the whole system as a whole. It's about the residents, the patients, and operations. It's not about you. So my rant's over. So the whole point was literally stop being rude to people. Stop it. Start building people up. You'll get more flies with honey than you're going to get with vinegar. Have a nice day.